Hi, everyone. It's Dr. Z, and welcome to another episode of Next Up Narcissism. Today, I am super excited about our guest because not only is she a colleague of mine, but she is a dear friend. Today, I am honored to have Dr. Sue Varma with us today to discuss artificial intelligence and therapy, the future of psychology, and practical optimism. Dr. Sue Varma's dedication to mental health is underscored by her pioneering role as the inaugural medical director and psychiatrist of the esteemed 9/11 mental health program at NYU, for which she was awarded a mayoral proclamation. She is the recipient of numerous prestigious awards for outstanding public service, for teaching, and is a two-time ShareCare Emmy Award recipient for her cutting-edge media work. Dr. Varma is a distinguished fellow of the American Psychiatric Association, the highest distinction bestowed upon its members. She was recognized as one of the world's top 5 leading health experts by Global Citizen for her contributions during the pandemic. Dr. Varma's highly anticipated forthcoming book, Practical Optimism, is currently being translated worldwide, offers practical and compassionate tips for exceptional mental wellness in turbulent times. This episode is going to be full of good nuggets of practical optimism as we delve into the world of AI and what that means for psychotherapy. This is going to be a really interesting episode, and I hope you get a ton of good information from this one. Hi, everyone. It's Dr. Z. Welcome to another episode of Next Up Narcissism. Today, we have a very dear friend to me that is someone who I consider an amazing colleague. She's brilliant. We have Dr. Sue Varma. Sue, I'm just going to hand it over to you to kind of introduce yourself. And I'm just beyond thrilled that you're here, that we can finally chat.
Thank you so much. And likewise, I have so much admiration and respect for the work you do. And I love the fact that we connected on social media. And as much as we're always talking about, the downsides of it, like this is the upside. And I'm excited to be here. And, I love all the stuff that you do. And I love that we've connected. I'm a psychiatrist. I work in private practice. I work with people throughout the life cycle from, teens to people in their 80s. I work with couples. I do cognitive behavioral therapy, couples counseling. And I wrote a book which came out almost a year ago now. It'll be February 20th. It'll be the anniversary. February 20th. It'll be a year.
Wow.
I know.
That went fast.
Time flies. There you have it. Practical
optimism. It's first of all, one of my favorite covers because, but it's one of my favorite books. I'm not just saying that because it's you, but it really just breaks down. It just breaks down life into manageable and relatable little nuggets of information. There's just these tiny little nuggets of information you can carry with you throughout your day. You don't have to have anxiety, depression, or anything like that to read it. It literally is for everybody, and I highly recommend. Yes, and I'll link it on the show notes for everybody they can click on. So we're just going to get straight into it. So we're talking about something a little bit different today that we normally wouldn't touch on, but it's all related, and I think it's super important. And that's on AI, artificial intelligence, in the field of mental health. Obviously, there's positives and negatives, but I really wanted to get Dr. Varma's input on this as a psychiatrist, what she thinks of the whole thing. And we'd gotten a bunch of questions about this, and I'm getting questions constantly about it. I can see both sides. As a practitioner, I can see it, but also as a consumer of mental health services, I can also see how that could be problematic. So let's just kind of jump into it. What would you say are the positives of AI in this field as far as how it can help people and support mental health in general?
Yes. So I'm always a proponent of trying to find new, safe, effective ways to expand the repertoire of the types of treatment that we have available. And what I see AI being helpful for is one, from a psychoeducation perspective of being more informed consumer. So if you are in therapy and you want to learn more, you want more information, and you want to be able to synthesize a lot of different sources. Because right now, Google feels so old at this point, even though that, I'm thinking joking around, there was the card catalog back in the day, right? Like you went to the library, you had to go in person, right? And then you have the internet, and then now this is a whole new revolution. And I love the fact, like, I learned so much. I'm just thinking about ChatGPT, but I've also caught at times when I've used it for travel purposes, gotten sent in the wrong direction, things that don't exist anymore. So you really have to do your homework. I think we're in the initial phases still. Everyone has said, like, this is just a drop in the bucket. There's an explosion of things that are going to happen and that are happening. We just don't have access to it, the average person, and it's expensive. It'll become more available. So I think education is one. I'm also thinking, I have patients who tell me I'm preparing for a job interview and I was trying to anticipate all the kind of questions that an interviewer would ask me, and I wanted to go back and forth, or I'm really dealing with a difficult situation. I think my partner is cheating on me, or they're not, I'm not sure. And so I was asking ChatGPT questions and asking for advice. And so when I'm seeing my patients utilize it, then I become curious and started to interact with it and asked questions. And what I found was interesting was a very balanced answer. So if you were to ask ChatGPT, what am I supposed to do in this situation? What is right? What is wrong? It's fascinating to me that it would say things that sounded upbeat, positive, and trying to take a global picture. Like, while I can't speak to you in specifics, or I don't know all the details of your situation, it sounds to me like, and then it would say, probably talk to a mental health provider, probably talk to a trusted person. So kind of like the things that we would say in therapy, or that if we were to put out education, disclaimers, and saying, in this situation, I don't have the full picture. But I've also heard of, like, there's lawsuits of young people engaging in AI, not necessarily for therapy, but thinking that they're in love with somebody, and then this bot or, virtual personality alluded to the fact that, maybe you shouldn't live anymore, or that was the perception, at least. So I feel like if someone is vulnerable or sensitive and has a predisposition or a history of mental health disorder and isn't getting help or doesn't have the right social support, that just like any other source of information could be misinterpreted however you want. This could be one more. So I'm open, but I'm also thinking that there's something about the human connection that I'm afraid that is going to be lost. And that's already lost in every aspect of our life. Like when you think of all the facilities that we have, from being able to order food, like you never really have to leave your house. You can work from home, you can eat from home, you can be entertained from home. So those, what I call micro connections of like in-person interactions, or even the fact that we used to once rely on our village, which we don't have anymore, as parents, to be able to ask a neighbor for help. Like there's apps and services that are being outsourced if you are lucky enough to be able to access and afford them. So the need for other people is really rapidly dwindling. So that's my fear and concern.
So you mentioned something that kind of triggered something in my brain. How you're saying it's giving balanced responses based on what kind of values or morals, or I guess is what I'm saying, because there's balanced answers coming from different, people of different values are going to have different balanced answers. So I guess where is that coming from? If you can even answer that.
Yeah, that's such an interesting question. And look at, it makes me think of like when we think of therapists and like culturally sensitive, culturally informed therapy, you're right, because it's probably very much from a Western perspective. Like I'm just thinking of, for example, like patients that will come in, like, who are, let's say, of Eastern descent, South Asian cultures, where society might be more collectivist and not like individual as the forefront. When, I'm just thinking about myself growing up in a South Asian household, or when I was seeking therapy as a young person, or, any number of things, and you're trying to tell your therapist, my parents did such and such. The Western response might be things like, well, you can cut off that family member. And that's just not something that's done. So I'm just using one example of when you think of the value system, you're right. Like it's not going to be applicable to everybody. And I think that that's really important. And just in general, what I'm learning is that you have to kind of phrase your questions appropriately. And I think AI has to, what is helpful if they're able to recognize their limitations and tell the person that, because I think that's the most important thing, that to say, while I don't know your specifics, so to have that disclaimer up front and to say, just this has to be applied to your situation. But I feel like that's where we have to train it to say, given what you know about me or my circumstances, and give it the background. So yeah.
It almost would seem that, just like you seeing a patient or me seeing a patient for the first time, the whole first session, even sometimes more, is spent getting a history, right? And the reason for that, even more than just what medications are you on and things, but deeper, things like, tell me about your family of origin, tell me about this, tell me. And so we kind of get this sense of who we're going to be working with, right? Where their vulnerabilities are, where maybe they don't have as much insight and awareness because of certain developmental things that had happened along the way. So it's interesting to me because it seems like it would leave out a very significant chunk of, I like to call it's kind of the stuff that we do that's not visible to the client, right? Like the connections that we make for patterns of behavior and, and things like that. It informs us of how we're going to respond. So without all of that, it's going to be giving very basic information, which, don't get me wrong, could be extremely helpful. And if that's, if you're limited in your resources, or, you live somewhere where there is no psychiatry or no psychologist, and for whatever reason, you're not doing Zoom, they're not offering it, there's no online therapy, then I think it's a good resource versus having nothing. But I do think it misses a significant chunk of history and how that history plays out into their patterns of behavior.
Yeah, totally. And I think of it, that's why I feel like it could be helpful from a psychoeducation perspective, which is like, what are my options and do I need help? Right. So like, just kind of like the way we would do an online search, like on WebMD back in the day, to be like, these are my symptoms. And hopefully, like, let's say if you were to say something like, I have a fever of, my child, my 6-month-old has a fever of 104 degrees. It would say for how long, and maybe you should go to the emergency room. So like, if those type of basic algorithms to be like, how long have you had depression for? Do you have thoughts of suicide? And then if you meet like a certain threshold, then it's like, you're in the low category and let's continue to observe, or you're in the medium and high risk and you should get help now. And I'm also thinking of what you're saying of, when you're sitting with the patient, what we have is the mental status exam, which is the equivalent of the physical exam of what a primary care doctor might do. And in that, we are assessing everything from eye contact to, is a person having abnormal movements? Are they having tremors and twitching? Are they having akathisia? Their voice. Yeah. How quickly, how rapidly. So, yeah. So everything from head to toe. What is the person wearing? Do they look their stated age? How is their body habitus in terms of nutritional status? Eating disorders, body image issues, height, weight, being able to inform them on exercise. And, I get labs on patients. So to look at like, what's your vitamin D? What's your thyroid? Your vitamin B12? All of these things can affect your mood. Do you have a thyroid abnormality? There's so many things that we would pick up by physically looking at someone. Their speech, is it rapid? Is it logical? Where if you're typing in something, it's missing all of that. But I know that there are, I'm sure, going to be developed situations where you're going to be doing remote therapy with, I don't know, virtual.
But also, what's your baseline, right? Like if your baseline is always coming in sweatpants and sneakers, and and that's your baseline, that's one thing. But if you're always coming in very put together, right? Very, very, just you have it together. You're always looking a certain way. And then for 2 sessions, let's say you're coming in, you're disheveled, you're not showered, and you kind of, you smell. I mean, those are, again, things that will be missed, even though you'll be able to see the person, let's say, eventually. You don't have that baseline. And I know people listening are saying like, well, what does it matter what they're wearing? It actually matters a lot. It matters how they present compared to their baseline.
Yes, totally. And it's funny, when I was in my residency training, I remember there was a woman who had come into the inpatient hospital, and it was such an interesting detail. And I don't know how, like, this is like, almost 20 years ago. Now we would balk at this idea, and it was a male attending, but he was like, look at the patient's hairline and look at the dye. So you saw like growth of her hair of like, 3 inches. And then you saw her hair color down here. So he's like, how long do you think it took? He's like, you can just assume that she had, was once someone who was very on it. And then at some point, like, was like, I'm done. And that could be any number of reasons. Depression isn't the only reason why a woman, she might be like, I don't want anything toxic on my hair. I've made an active, conscious choice. But it could also be part of a constellation of maintenance for that person. We're not assigning judgment, right or wrong. You should do this or that. It just means, like you said, the departure from that particular person's baseline of how they considered self-care and maintenance.
So let me ask you this. So anxiety and depression, it seems like from a psychoeducation standpoint, you go in, you ask your questions, it gives you pretty basic information, maybe puts you in categories, like you said, severe, moderate, mild, and actionable steps that you can take based on how you feel. What about personality disorders? Because personality disorders take on a whole different type of conceptualization from as the therapist. How, I guess my question would be, how would an AI therapist be able to understand the complexities, to understand that it's a personality disorder who also has anxiety, let's say?
Yes. You know what I find? These are such great questions and they're so thought provoking because even as psychiatrists, like we're not necessarily thinking of all of the things that we do as part of assessment that we take for granted. And, before I answer that question, what I'm thinking of, so much of why therapy works in my personal anecdotal experience, and yes, there are studies on this, it's about the patient doctor or patient therapist rapport, right? And that feeling of being seen, cared for, heard, validated, supported. Someone is celebrating your wins. Someone is giving you time and attention. Someone believes in your dreams and promotes them. That cannot be replaced, right? Like, and so much of why we're coming to therapy are because of wounds. Like I'm thinking of the idea of transference, right? And transference and countertransference. That happens between two living people. And yes,
Will you
we
kind of
get
explain
trained.
for people listening what that is, just in case people aren't aware?
Sure. Yeah. So this idea that like, we have these relationships, early relationships, childhood with our parents, and there's a certain dynamic that we keep reenacting with other people in our lives, and we can't help but reenact that with our therapist. So we project onto our therapist some personality of a mother or a father or an important caregiver. And we then, start acting in ways that kind of recreate that relationship in the room. And a sophisticated therapist would understand that, who do I represent to you? Because I'm noticing that you're pushing back on me or you're finding me to be critical or, what is playing out here? And like a lot of times therapists don't ask those questions, but if they do, it was very insightful to be like, you remind me of my dad or in this instance, and I feel like there's so much breakthrough that can happen between two people when they trust each other. There's a rapport established and a patient isn't going to feel chastised for being so vulnerable and honest to say, you remind me of this parent and I didn't like them or I liked whatever. Even it could be positive. I feel safe with you because you remind me of this person in my life. And then the countertransference is, what does that patient invoke in you, and elicit out of you a response also based on your own personal experiences, in life. So much of what happens, the benefit in therapy is about the rapport, the trust, the safety, but also the fact that there's accountability, where someone that you respect or
Yeah, I think
admire.
that's key. Yeah.
Yeah. That they're expecting you to show up, right? That they're rooting for you or that they're going to push you and challenge you, but it comes down to like there's skills and training and insight and clarifications that happen in therapy. But I feel like, I don't know what number it is, but a vast majority of the benefit that a person gets from therapy is that therapeutic relationship between two human beings. And you just can't replace that.
That's right. And I even know, when they do outcome studies to see what variables promote the healthiest or the best outcome, it's always social support. It's the support aspect of it.
Yes. Yes.
So
But we didn't answer your question about the
Yeah.
personality stuff. That's fascinating to me. And I wonder if one day the AI therapist would be sophisticated enough to say, I'm noticing a pattern of behavior where you are, for example, in borderline personality disorder, whether it's an intense idolization or devaluation or this sort of unstable pattern of behavior. Like, I wonder if it would be able to read between the lines
Right? Because
oh, I'm noticing.
that's what you do. You read between the lines for personalities. You nailed it. That's exactly what you do. And I can't imagine. Listen, maybe I'm wrong. I never thought we'd even be having this conversation 20 years ago. But maybe it could read between the lines. And then once it does, what do you do with that? What do you do with that?
It would have to be like, it would be smart where it would have like an algorithm to be like, I'm noticing a pattern of, like it would always be sizing somebody up and putting them into a category. And that aspect, some people like it and some people don't. They're like, I'm not just, because I've had patients say to me, like, if I've wanted to give them a depression rating scale, I've had gotten pushback to be like, and then what? What are you going to do with that information? Why do you need to know that I'm depressed? I want to be treated like a person. I don't want to be treated like a diagnosis. Are you going to recommend medication to me as a result? So I can see that very quickly it'll say, this is what you have. Like, I'm just thinking of all these, like, the MMPI, these like personality inventories or diagnostic tests. Like, yes, you can do them online. Yes, you can come up with areas of concern or challenge or diagnosis. I don't know, but you're missing something at the end of the day.
And I think so. I know you feel the same way as me with this. So I may offend some people when I say this, but I'm going to say it. So I think a lot of this comes from the misconception of what therapy even is. Because I cannot, and I'm sure you have this, I cannot tell you how many times I'll have a new patient coming to me from a former therapist or a new patient that's had therapy in the past. And even just people that haven't been in therapy, it's like, there's almost this misconception that therapy is just talking to somebody. And honest to God, it's one of my biggest pet peeves with what we do is that, and it's to no one's fault, but it's that misconception that when you're in therapy, you're just talking. And while, yes, obviously you're just talking, the danger in that is you end up talking in circles with no actionable steps to take, with no behavior change. You're just talking, which really at the end of the day is no different than rumination and worry at that point, because you haven't taken any steps. So the support aspect is there. I get that. But, I think people going into this may have a misconception of therapy that it's just talking. And they think, okay, well, if I can't talk to a therapist, I'm going to talk to AI, not understanding that there's, as a cognitive behavior therapist, as somebody who's, has a different theoretical orientation for this, it isn't just talking. There's so much more to it from the provider side. So what are your thoughts on that?
I feel like, yes, the talking part, I think a lot of people reduce therapy to not understanding. Either they reduce it or they're afraid of it for those exact same reasons, right? That somebody is going to, like, just think of like the social conversations that you might have had. I know, like, this, it's less so, but back in the day when I would tell people, let's say 15 or 20 years ago at a cocktail party, like, this is my field, people get very on edge and become hypervigilant, and they might shut down, or they might make the joke, are you analyzing me?
I always get, are you reading my mind? And I always used to say, I can't do magic. That was always, I'm not a magician, right? I always would say that because there's this idea that like you can see into their soul.
Yes, yes. And I would say
Right.
things like, I'm not a psychic, I'm a psychiatrist. Like, no, I can't read your mind. I don't know what you're, or I would joke like I'm off duty, I'm not on the clock
I love
here.
that. I love that.
And,
Yeah.
and so, like, I'm like, no, I'm not analyzing you because like, you're not like, we're not in that context. You're not my patient in this, we're meeting socially. And sometimes what's interesting is sometimes people would meet me socially and then we might have had a very open, honest, raw, vulnerable exchange where I've now just shared so many personal details of my life. And then half an hour later, they're like, are you open to new patients? Are you taking on? And I'm like, wait, we met in a social context. I get it. Because people want to see someone that they can relate to. But now I've just told you all about my life and I saw you in a sort of friend context. So like I'm thrown off because I wasn't thinking that this person would be a former, so I know that there's all sorts of people have different comfort levels. Tons of people would say, I don't see the problem in that. I would see this person as a patient. But for me, like, I think I'm a little old school in that sense, is that you want to maintain a certain amount of neutrality and objectivity. And sure, we're both online. We both share certain aspects of our life. But for the most part, I think it's a very delicate line of, that personal part of it. So I think sometimes it could go both ways, where somebody might reduce therapy to just talking, or the thought of talking freaks them out because they're like, you're going so deep and I don't want you to know, things about me.
Yes. Right.
So it could go both ways.
It's like you think about all these things and your mind goes a million different places, and it's so, I can't even imagine what's going to be out. It blows my mind. So with that, one last question for you. With all of this stuff that's coming out, with all these advances, whether it's good for the field of psychiatry and psychology, who knows? There are benefits. There's definitely, some downsides to it for sure, but hopefully they have people working with them that will understand the nuances that we're talking about, so we don't just dismiss a person's subtle, amazingness we don't want to miss that. And their subtle patterns that they have that wouldn't be picked up. But with all this in mind, it's extremely overwhelming. It's extremely overwhelming to me as a provider. It's overwhelming to people as patients, or just in general. Just the idea of turning all this over to AI it's scary. And it feels like your foundations it's kind of shifting and we don't know what's about to happen. So with all that in mind, how do you recommend to people to stay grounded and to stay optimistic and open-minded, but at the same time, appropriately cautious?
Totally. I'm always of the belief that we should stay open-minded to new technology and new, interventions, but at the same time, know what is kind of important from the analog world, and I think what's interesting about us, as therapists in this particular generation is that we are lucky to have known a childhood that was digital and device free, but then also have like a young adulthood and adulthood that was exposed to the digital world. So we kind of have, I feel like, the last generation that has had the best of both. And so, when I talk about optimism, I say that there's a lot of like just basic tried and true things. And, I was once in a situation where there was a TV program. It was during the pandemic. It was with Global Citizen. And they said, okay, we're doing this one night benefit and it's going to be with, I don't know, Elton John and Rolling Stones and Oprah. And like, I was like, great, like I'll be watching that program. And I was like, and they were like, no, we want you to be on it. And I was like, to do what? I don't sing, I don't dance. And they're like, no, just like, talk about mental health. We want you to give inspiration and advice and like, how to, cope, like the peak of the pandemic is coming and provide hope to people. And I was like, that's a tall order. Like, do I have an hour? And they're like, no, you have 59 seconds. And I was like, 59 seconds to give hope, inspiration, steps, tips. Like, how is that going to happen? Right. And I remember calling my dad, who's a psychiatrist, and he's like, it only takes a second to save someone's life, and I was like, okay, thank you, Yoda. Like, we're not going to do that piece of information.
Right.
What do I say in 59 seconds? So, what I share, which is in the book, is the 4 M's of mental health. And I just think of, for me, these are my top 4 science-backed habits. Look, optimism is something I never looked at it beyond, I worked with 9/11 survivors. I was the medical director of the first 9/11 program at NYU many years ago. And we were thinking about resilience, and optimism was one key feature, this idea of seeing the glass as half full and as opposed to half empty. But it was something you were either born with or not. And then I was like, then you're screwed. If you're not born optimistic, then you're not going to have resilience. Like, but we all need it. So then I spent the next 20 years of my life going on the hunt of, why is it that optimists are healthier? And healthier, wealthier, wiser. They live 20% longer. They're 40% more likely to get a raise in the next year. They're 30% less likely to have heart attacks. They have less anxiety, less depression, longer and stronger friendships and partnerships and marriages. And all of this is because they do certain things. I say that optimism is what optimism does. So if I had to give in 59 seconds 4 key takeaway habits, and these are my 4 favorite, but I would also add sleep and nutrition and other things to it. But Mindfulness, 1 minute meditation. Every single day, do it for 1 minute. If you can do it for longer, great. If you have more time to do it, throughout the day. So that's the mindfulness, doing something just single-mindedly. Movement. We know that 5,000 steps is enough to keep depression at bay. So if you want to do prevention, you want to do maintenance, make sure you get at least 5,000 steps a day. Strength training is even better if you can add that to it 2 to 3 times a week. Meaningful engagement. Have friends that you go deep with. Micro connections, talking to the barista, the dog walker, your doorman, the stranger, if you feel comfortable. The water cooler conversations at work if you can. Be very intentional about once a week in person, going deep with a friend if you have to. And then mastery. You don't have to be a master to experience mastery, but get a hobby. The rage is grandma hobbies. Everyone is like knitting and crafting, the teens, because it's a big social media trend. But get a hobby that you're not doing just for a performative nature, like because you truly enjoy it and it feeds your soul and you get into the flow state and then you're not ruminating as much. So those are my 4 quick 10 minutes a day. Do each of these things, but really optimism. I hope people get a chance to get the book. I have 8 pillars in there, and it walks you through how to have how to have purpose in life, how to process your emotions, how to problem solve like a badass, how to have proficiency, which is confidence in your abilities, people practicing healthy habits. So you can take any goal that you have this year and say, how do I create a vision? And I lead you through very, very concrete steps. And then how to make.
That's what I love about it. It's like those nuggets. It's just so relatable. Yeah.
Yes. And how to execute. So I'm all about, I want action. I want delivery. I want results. People think optimism is woo woo and it's anything but that. So I hope that people get to engage, and I'm always open to technology. So I love that we had this conversation, so that we're evolving very much. So, this conversation might be moot, a year from now or 5 years from now. But this is where we are at this point.
This is where we're at.
But the optimism will stay with you for life.
That's correct. Yes, absolutely. Because it's something that it's a process, and it's an ongoing process. It doesn't end. It never ends. It's like, it's like you are constantly evolving your optimism. It actually doesn't even make sense that it would be something that has a final endpoint. It just doesn't. But thank you. You're brilliant. I love your work. I could talk to you for hours about this stuff. But Dr. Varma, thank you so much for joining us. And I will link the book to the podcast so that people can order it. But yeah, thank you so much for this. Appreciate it.
Thank you. Thank you so much. So great talking to you always.
Thank you for tuning in to another episode of Next Up Narcissism. I hope you found it useful, but most importantly, I hope you found it validating. Want to work one-on-one with me? Visit my website at drjamiezuckerman.com to book a personalized coaching session, and be sure to check out my on-demand workshops on topics like co-parenting with a narcissist, life after leaving, anxiety management strategies, and more. Again, that's drjamiezuckerman.com. You'll also find links to my interactive workbooks, merchandise, resources, and newsletter sign-up. Next Up Narcissism is as much your podcast as it is mine. I want to hear your feedback and what you want to hear. So make sure to leave a podcast review wherever you listen, or send an email to nextup@drjamiezuckerman.com. Again, that's nextup@drjamiezuckerman.com. Be sure to subscribe so that you never miss an episode. And as always, thank you so much for listening. Make sure to tune in next week to see what's up next on Next Up Narcissism.